The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for, professional medical advice.
Sweaty and pissed. Menopause makes me sweaty and pissed.
Well, hello, my darling.
Hi, Leanne. Here
Hello.
we are, at Sweaty and Pissed. Menopause and more. We're back.
Yay.
Yay.
I know, it's just like home.
Yeah, so last episode we sort of got caught up on what you've been up to, and I'm glad things have settled down a little bit. That's good.
They have. Yes, thank you, my darling.
And in the meantime, we've had a lot of Facebook feedback, which has been
God
really
love
great.
'em. I know.
I mean, talk about words of
Sweet.
affirmation, that your love language. You should be loving our Facebook page because there, we've gotten a lot of positive feedback. It's
I
been
know.
great.
And
Yeah.
every show that I've done, this year, people come up and go, "Oh my gosh, I've been listening to Sweaty and Pissed." I didn't even know how to work a podcast, and that has really helped me. And they all say, "Oh, Karen is brilliant."
Well,
so
good.
I know.
Well, one of the things that happens on our Facebook page is we have a lot of listeners who have asked questions. And I thought we could take this opportunity on this episode and maybe the next to answer some of the questions that we've received. Actually, I think I've written most, if not all, the questions we've received on our Facebook page. And I think I responded to most or all of you directly, but I thought your questions are questions that probably other people are asking too.
Oh.
So we might as well read them out loud and give the answers on the show.
Okay.
Okay? So if you have any experience in any of these things, we'll get your input
Well,
on that.
on the last episode, I certainly had experience with sweat in my folds.
So the first question I have is from Sharon, and she asked, can you put estrogen cream directly on your face? And the answer to that is yes. The simple answer is yes. For a lot of women, I will compound a fairly weak estrogen cream and have them put 1 click, which is 1/4 of a milliliter, mix it in with their moisturizer, and then apply it to their face and forearms especially, because that's where we tend to get crepey and get easy bruising when that skin gets weak. So that helps with collagen building on the face and the arms. And so when I do that, however, I do that mindful of what they're already taking in terms of hormones and factor that into the amount of estrogen they're getting every day. So I may adjust their capsule or troche or cream, whatever they're taking systemically. I will adjust that probably slightly just to accommodate for that extra estrogen. But it does really help. I believe this listener had some Premarin cream. Premarin's not my favorite thing because it's horse estrogen and it's a conjugated estrogen, so there are several different types of estrogen in it. But technically, you could put a little dab in your moisturizer. So you're just putting a little bit in your moisturizer to apply to your face or arms. Have we done that for you? I thought we'd done that for you.
No, Karen, I'm pissed.
Well, and sweaty. Well, yeah, I think, maybe we've just been dealing with other things, but yes, that's something.
Because I've got
do.
my estrogen cream and I click it twice. I could click it 3 times. I don't know why I've kept it at 2.
Yeah.
Could I click it a
And
third
put it in
time?
your- put it in
and
your
put a little dab.
Yeah.
Because I already do it on my
Inner arm.
inner arm.
You have separate estrogen cream, right? I'm trying to remember off the top of my head.
Yes, from.
I mean, it's not you don't have progesterone and testosterone in it.
No,
It's just
I do
estrogen.
that separately.
Yeah, okay.
Correct.
Yeah, so you could take the estrogen, which is a biestrogen that you have, and put a click in your moisturizer.
And put it on my face
And-
and around my eyes.
Yeah. And you should see the look of shock and
Well,
surprise.
I'm going to do that.
And horror
Because
that I
I have
haven't
felt
told her
very
this.
crepey and old, and and it's when you go through stress, like a parent ill or
Yeah.
whatever, some kind of thing. I have felt like that's really worked on me and my skin and just how I look, and that's why I have not been doing videos, because I don't want people to see my neck.
And you're during those times we're not sleeping well, we're not eating right. When you're in a hospital all day, it's very difficult to eat right, or eat well.
And you can get a spray tan, but it doesn't always help. Believe me, I would try to go and get one to make me pep myself up.
Yeah.
Okay, so I will try that. Yay.
Yeah, but don't forget your forearms.
On the top of my forearms. Okay. And do you think that I look like I've had sun damage from the beach? Because I really tried not to.
No, I can't believe you're
Okay.
just back.
Okay, yeah, I covered up, and
Yeah.
I really tried.
The other thing I should mention about that is if you're putting estrogen on your face and your forearms, or just your face, whichever, just remember that you can transfer that hormone with skin-to-skin contact for 6 hours after application.
To a man, if they're
To anybody. You got
they're
somebody
making you do
snuggling
it.
up against your face.
Okay, what about a dog? I've got a dog butthole up against my face.
Well, then he deserves to.
Gigi.
No, probably the fur would help avoid that. That's sort of
Okay.
like wearing clothing. So if
Okay.
you had clothing over your forearm, for instance, you're not going to transfer it. It's skin to skin contact.
Well, I've got on a Soma gown that is, because I get so hot, that I will transfer that to Chuck Morgan, but I'll tell him, do not touch me.
Well, you could put it on in the morning. That's the other option.
Can I? I thought have been doing it at night, but that's okay. I mean,
Yeah.
oh, the click on my face,
Right. In your moisturizer.
Well, I might, Karen, but just to be able for him to leave me alone. Not that I don't love him, but
Okay, so you're going to use it as an estrogen shield then.
estrogen shield. Now that I don't have that plantar wart anymore on the bottom of my foot, that helped deter from sex. But now I'll just say, oh gosh, I put my estrogen. Chucky, you
cream
don't
on.
want to have estrogen on you. What would it do to Chucky?
Well, men do have estradiol in their bodies, but it should be very low level. And estradiol can stimulate prostate tissue. So say you had an abnormal cell in the prostate, that estrogen could stimulate that. And it can stimulate other things like cysts and kinds of. So
yeah, we don't want that.
I mean, a male's estradiol level should be at least below 50, ideally below 30. So if he had exposure to estrogen and his level was 80 or 100, that's not good. That is way too high.
Okay.
So that's just something to remember. 6 hours. That's what you need.
Okay.
Our second question are, what are options for those who have very strong family history of breast cancer, and when you're trying to address peri and postmenopausal symptoms? This is from Lauren. So she's asking if she has a strong family history and is concerned about the history and using hormones, what can you do for those symptoms? Well, first of all, I would say that it's estrogen that we're most concerned about, because estrogen stimulates cell growth in all the sex organs. Progesterone slows cell growth and matures the cell. So in perimenopause and even in menopause, progesterone could be an option for you. If you want to do some hormone therapy, progesterone could be an option. Some people with a strong family history are just too nervous to even do that. I tell people, if it's stressing you out,
Yeah.
it's not worth doing it because the stress and worry is worse for you than replacing the benefits you'll get from replacing the progesterone. So, but progesterone could be an option. The other thing is obviously to address the symptoms with either supplements or I think at the last episode we talked about things like the bed jet and Blankwill, some of these cooling devices, certainly like cooling pajamas, wicking clothes,
yes,
stuff like that. The Lume topical cream and deodorant that helps with sweating. But and I know I've mentioned this on previous episodes about the website Patch MD.
Love them, honey. Got on a patch right now. Got on a vitamin B6. I will go to bed, and I also have an anti-aging on. I will go to bed with a menopause night, and a melatonin sleep starter patch. Love them.
Is that helping with your sleep?
I feel like it does.
Yeah.
I mean,
I've had people really get a lot of benefit from their menopause night patch. The sleep starter patch is a good add-on, like you said, but the nice thing about the menopause night patch is it has the ingredients that the sleep starter patch has, but it also has a lot of ingredients in it that help specifically with menopausal symptoms like hot flashes and night sweats. It's things like black cohosh, and it has like L-theanine and some 5-HTP, some things that are just very calming.
and it's all natural, right?
Right. So there's no hormones in that option.
And there's a menopause daytime.
There's a menopause day patch.
They've got a vitamin D.
Yeah.
3.
And
they got
and the other thing that's a big complaint in perimenopause and menopause is the brain fog, and they have a focus patch too.
And I think they've got 40% off. Well, I mean, they stay with 40% off. They have deals all the time.
They have coupon codes. Every time I've gone on their website, they've had some kind
I
of
feel
coupon.
like Superwoman with my patches on. I think, and you know that I've not always been like I'm supposed to and want to swallow a pill.
Yeah.
Or do, the vitamin D under the tongue, and I'd forget.
Right.
But something about just slapping that little tiny patch on, you can't feel them.
Yeah, and they're
You wear
not
'em for 8
super
hours?
sticky. They're not.
No.
Yeah.
Honey, I wore them with my tankini from Land's End on the beach.
Yeah.
I mean, they're not waterproof, but
No.
I didn't go in the pool with
Right,
them. But
right.
but I wear them all the time. I love them.
Yeah, so that's a
a good
really
thing
good
for
option.
women
You're
that-
not taking a lot
Oh.
of pills. It's got a lot of different ingredients in it and that's the thing about natural, I'm putting air quotes here, natural supplements to address symptoms is it typically takes more than one to really help with the symptoms. Just like most people when they take melatonin don't get
Yes.
great sleep benefit, but if you take melatonin and valerian and
GABA
magnesium and GABA,
L-theanine.
yeah,
I remember when you talked about that.
When you start combining them, people do a lot better. So that is certainly a good option for somebody who wants a non-hormonal option. Again, the progesterone is could be a good option for you. I've mentioned Dr. John Lee's books before, but since you have a strong family history, I would urge you to read his book, What Your Doctor May Not Tell You About Breast Cancer, and it will explain to you the role of progesterone in our bodies and how it can actually provide slowing of the cell growth in the breast tissue. So I would encourage you to read that so that you understand that piece and are just more knowledgeable about what is a good thing and maybe a not so good thing in terms of hormone replacement with a strong family history. But that's an excellent book. Also from Lauren, that was from Lauren, by the way. And also from her, she's asked, what is Karen's take on working odd hours and what does it do to worsen symptoms? which is a great question.
That is a good question. We've never talked about that.
Well, we've talked some about adrenal function and supporting your adrenal glands, because your adrenal glands regulate your wake sleep patterns with cortisol. Cortisol is what we call a diurnal hormone, so it changes during the course of the day in terms of levels. So it's highest at 8 a.m., so you get up, get going, have energy, and it's lowest at 2 a.m., so you sleep, and then it starts all over. Same pattern. Supposed to be the same pattern every day. So the problem with night shift work is that you are asking your body to do something, do your work during a time of day when your cortisol is at its lowest. So in your body's effort to adapt to that, you can get the cortisol flip-flopped, so you have higher cortisol at night and lower cortisol during the day. But what I see with most, if not all, the patients I have who do shift work the night shift, is they don't stick with those hours on their days off. They'll, because life happens during the day,
Yeah.
so on their days off, they'll be up all day and sleep at night. And so it's really hard for the body to figure out which pattern it's supposed to do. So sometimes you'll just end up with sort of flat cortisol levels at all times, so that your body's giving you some cortisol, but not in a peak and valley manner. And it makes it difficult for people like me to help you with supplementation, when to take supplements like phosphatidylserine, which is abbreviated PS. It's an amino acid that can help keep cortisol levels down. So I usually have people dose it at bedtime. Well, if your bedtime's changing, if 2 days a week your bedtime's at this time and 5 days a week your bedtime's 12 hours later, then it makes it very difficult to figure out how to support the adrenal gland. There's some people who do great with night shift work, but I really encourage my patients, if they're not doing well, to do everything they can to get on a day shift. Yeah.
Could that have the same effect of like a mom with a newborn baby?
Yeah. So
like when you're up all night with a baby?
Yeah.
Because I
It's the
remember.
same thing. I mean, that sleep deprivation is brutal. But it's true, your day nights get mixed up. So night shift work is problematic.
Oh, and all those nurses with my mom
Oh, I know.
are there all night, and
I know. And I know for most nurses, when you're starting out, you don't get the primo shifts, you get the night shifts. That's what is available. And you have to have some longevity in the company or in the hospital before you'll be changed to day shift, which is problematic. The best thing to do, if it's possible, is to keep on the same schedule on your days off. But I understand why people have a hard time doing that.
even people that are not on a night shift. You sleep later on the weekends, and I've always read that try to get up at the same time every day.
Yeah.
Try to go to bed. And I read this the other day, to go to bed before 10, that your best sleep is between 10 and 2.
Mm-hmm.
And so if you're setting up past 10, you're kind of missing getting in that rhythm.
Right.
So to try to go to bed before 10, and I've really been trying to do that.
That's good. Well, it's hard too when you're a performer.
Oh, no wonder Loretta Lynn got on pills. She's off of them, everybody. But I mean, because you are up and then you got to wind down. And,
Yeah, because it's a night job.
Oh, and when I work a club and there's 2 shows and the second show starts at 10:30 or 10, I'm in a green room with a pot of coffee. I mean, I don't, but how in the world?
Yeah.
I got to figure out, if I said this before, what have I said? What am I saying now? And there are clubs in the United States that will have a 3rd show. And that's like at midnight and everybody's high and drunk. Can you imagine? I don't do those because I'm sure they would go, wait, who booked our mom? And they wouldn't want me. But I can't imagine
Yeah.
a third show. I would not know my name.
Yeah. Well, and then you're up for at least a couple hours after that.
Yeah,
Just
a lot of
trying to-
comedians set up all
night long.
Yeah.
Yep. It's a night shift job.
Yeah,
for
we
sure.
are very twisted people. But anyway, okay. Now, did you feel like you got that answered for Lauren?
I think so. Don't you think so?
I think so.
In other words, you're gonna have to
Well,
quit your job. No, get day shift. No, if you can, or keep the same schedule on your days off if you can. We'll do one more question and then we'll wrap this show up.
Okay, doll.
I have a question from Lori, and she was asking about some information on pelvic organ prolapse.
What in the world is that?
And what to do about that. Well, your pelvic floor has a big muscle there, and the whole pelvic floor can collapse, and or we can have the bladder prolapse where it's leaning up against the front vaginal wall and sort of sagging into the vaginal area, and the rectum can lean against the back vaginal wall and sag into that area, or the uterus, if you still have your uterus, can start dropping down so that it's falling down into your vaginal area.
Oh my word! I know you
I
talked
wish-
about this.
I wish
I
we
don't
could
remember
see-
hearing it down in your vaginal area, but I remember you talking about
Yeah.
the bladder and the rectum,
Rectum.
and I remember being freaked out.
Yeah.
And you know, when my little mama having a stroke, the OT is working on her pelvic floor
Yeah.
for incontinence,
Yep.
and she's doing so well.
Yes. Yes. So the things that you can do about that, first of all, are Kegel exercises. And I know we talked about this, Leanne, and talked about doing Kegel exercises, where you're contracting those pelvic floor muscles and doing it several times a day and doing it for about a minute at a time. And you start out with just quick squeezes because that's about all the strength you'll have. And then as your muscles strengthen, you can do squeeze hold for about a minute.
Yeah.
And by doing that, you strengthen the pelvic floor. And to find those pelvic floor muscles, you can find them by starting and stopping the flow of urine when you're voiding, so that you really pinpoint those muscles. Because lots of times I ask a woman to do a Kegel contraction, and they'll squeeze their butt muscles. I'm like, no, that's not it.
Yeah.
So it's really a different muscle altogether. So that's a way to find it. You could Google Kegel exercises and get all the information. But that's one thing. We use pessaries, which are little rubber devices we insert into the vagina to keep everything up, keep the bladder up, the rectum up, the uterus up. And they're all different shapes and sizes of pessaries that we insert, and they're removable. You take them in and out and wash them with warm water and soap and reinsert them. So,
And that does what? Keeps people from...
yeah, when you insert this pessary into the vaginal area, it just provides a support for that vaginal wall so that the bladder can't lean against the wall and the rectum can't lean against the wall and the uterus can't come down. It sort of creates a blockade in the vaginal area. So, and the other thing I mentioned to Lori when I answered her back is that it is what your mother is doing, what Lucille's doing is pelvic floor therapy. And, we have some really good pelvic floor therapists here in Knoxville, and I'm sure in your area, wherever you are, there are good pelvic floor physical therapists as well. And they do wonders in terms
So
of
if people are having incontinence?
incontinence, sometimes with the rectocele, meaning the rectum is leaning. We have trouble emptying the stool. And certainly if the uterus is falling down, if the uterus is really falling down into the vaginal area,
Yeah.
the only way to fix that is a hysterectomy if it's really fallen down. And there are also things like Mona Lisa Touch, which are those vaginal laser therapies that rejuvenate the vaginal tissue. And a lot of urologists and GYN providers are providing that service.
Do you like those?
Yeah, that really helps. And it's supposed to last about a year, but what I've seen with my patients is it's lasting more like 2 years when you do. It's a series of 3 treatments, and it really just helps rejuvenate that tissue so it's stronger, so that when the bladder is full and leaning, the vaginal wall is not collapsing under it.
I don't know if it's frequency of having to urinate like all the time. Like, I've seen commercials for a medication that if you have to constantly go to the restroom, and I feel like that's what's happening. I mean, I am constantly at the beach. I would say I'm going to walk up here to the...
Well, it sort of depends. I mean, one thing that can be happening is sometimes if the bladder is leaning, is prolapsing some, it never really empties well. It never fully empties, and you have retained urine in the bladder, and then it's just going to fill up more quickly. Mm-hmm. So that's certainly one thing. Some people, it's a bladder that is sort of just easily, it's easily irritated, so you'll feel like you have to go to the bathroom more frequently, and there are medications that help with that. And then certainly if somebody has frequency along with urge incontinence where you can't get to the bathroom fast enough, there are medications for that as well. But certainly if you have a lot of frequency, first of all, we need to rule out if somebody has a bladder infection. We start there, and then a urologist would check to see if after you voided, if you have retained urine. We would see if your bladder's prolapsing at all, and so sometimes a pessary can really help with that because it gets the bladder lined up better, so it empties better. So there are different reasons for frequencies. So certainly if it's a sudden new onset, that needs to be worked up. Yeah.
Okay. Yeah. Okie dokie.
Well, we've got a lot more questions, and we'll do that on our next episode.
Okay,
How about
my
that?
darling. Okay. I've had a ball.
Have you?
I have. What good questions.
Aren't they?
I know.
I
I'm
know.
excited to know what's next.
And we're grateful to you for your comments and questions on Facebook, and we hope you'll continue doing that. And we look forward to talking to you next time.
Okay.
Thanks.
All right,
Bye.
doll. Bye-bye.
Sweaty and pissed.